Hi there, this is Dr. Beth Ennis. This is the first time I'm doing anything on Facebook Live, so please bear with me as I go through this. So I'm Beth Ennis. I'm coming home from you to you from my home office in Belmont, Massachusetts, and I am the happy practice owner of Sleepy Dog Veterinary in Arlington, Massachusetts. At Sleepy Dog, we provide alternative veterinary medicine for dogs and cats and rabbits, and I love being there every day. So not being there every day has been a little bit hard, trying to figure out some ways that we can still help our patients while being under these quarantine situations. So today, what I thought I would do is talk about virtual care in veterinary medicine and how it applies to veterinary medicine in general, but also how it applies to Sleepy Dog. So with that, let me get started. So the things that I have been thinking of that have come to light during this time of COVID-19 include some kind of general things that I've been thinking about in the world and how it pertains to my practice in general. So one thing that I feel like the coronavirus is teaching us is how interconnected we really are. We are taking all these precautions to keep our germs to ourselves, but it shows how very connected the whole world is, be it the animal kingdom, the humans in and the animals within that, and how fragile that can be. So I just want to first send out all the love to everyone out there to give your pets a squeeze virtually from me to you and tell you all how we are all in this together. It is a fragile time, and I also think that it's helping us to figure out new ways to remain connected, whether it's with medicine, with communication, and using our technology to do that in a better way. So I have always been someone who has been okay at technology, not awesome, not horrible, but I like to think that it is really helping us now, and I'm trying to use it in different ways. So one of the ways that I'm trying to use it with is different telemedicine ways. So what is telemedicine? Telemedicine is one of the ways that veterinary medicine is making this all work. So telemedicine or virtual veterinary care can include anything from using the telephone to call and ask us a question, sending us an email to ask us a question or schedule an appointment. Text is sometimes something that we use in our clinic. We don't use it as often because we can't be answering it in an urgent way, but we've always been able to accept pictures or have people take a video of something that's happening at home and show it to us so we can weigh in on whether we think it's something we're concerned about or it's a reason for celebration. The other things that we've been incorporating lately, and a lot of veterinarians have, are video chats. So being able to have my clients on the phone and I can look at them in the eyes and see the concern on their face over something, reassure them that they're doing all the right things, or brainstorm ideas of how to make things better. So video chats can be really helpful. We can also do things like be able to see how a dog or a cat is walking. Sometimes we can even be able to tell what the mental status of that patient is looking like just by observing over the phone. And so those things can be incredibly helpful. The other things that we're doing a lot of these days is electronic prescriptions. So we are trying to limit our face-to-face and hand-to-hand contact. So being able to prescribe medicines over the phone or by email or by online pharmacy is a huge advantage right now. That way your pet can get their medicines by the mail directly from the pharmacy. And we've been lucky because all of our herbal supplements have been able to ship directly to people. And that's been really handy to help limit hand-to-hand contact and also make sure that our patients who are doing really well on those supplements and need them to feel comfortable are still being able to be taken care of. So one thing that is incredibly important when it comes to veterinary virtual care is the importance of something called the veterinary client-patient relationship. So what does that mean? In our world, a lot of people will say, oh, you must be so lucky that you're a vet. All you do is work with animals. And of course, there's nothing further from the truth. I love being a vet because I work with animals, and I love being a vet because I love to work with people. Every animal that I see comes with a person or more than one person. And in veterinary medicine, the most important relationship that we have with our patients includes their person. So the relationship includes the veterinarian, the client, or the person involved in the animal's care, and the patient themselves. This is something that is so essential for us in any kind of medicine, but it is not exempt when it comes to virtual care or telemedicine. So the relationship that we have, the knowledge that we have of what's going on in that patient or that pet's life is incredibly important and cannot be done without the client. In ordinary circumstances, that veterinary client-patient relationship includes a physical exam and me knowing as a veterinarian what that animal feels like to the touch, what they sound like, what their personality is like, what medicines they've been on in the past that they've done well for them or didn't do well for them. What are the challenges that they face? Are they a puppy who has no challenge in the world? Are they a 15-year-old animal who has multiple challenges? And so that's something that we really need to know a lot about. So in an ordinary situation, the reason why you may not call a veterinary clinic and get advice over the phone that's specific to your animal, unless we know the animal, is because it's not safe for us to deliver that information. Right now, we're in a bit of a crisis, not a bit of, but a crisis. And so it's important that we pay attention to all the things that we would do ordinarily, but also make some exceptions. Because this is a time of an emergency, the FDA has made some exceptions in terms of what veterinarians can provide. So we are able to provide more particular care to our patients than we would ordinarily. However, that being said, in alternative medicine, what I do, it is so important that I know what's going on. So I will rely just as much on all of the history around that animal, their medical records, all those things as well. So we will see, I believe, as we go through this process, we will see what things are more and more important in terms of providing that veterinary client-patient relationship without being able to have our hands on the animal. For most veterinary practices at this time, we're delivering curbside service. So that means we are still putting our hands on your animals, but we are limiting contact with the owner. So for most veterinary practices, that means when you get to the clinic, you're going there for an urgent matter, so it's not routine or elective care. You're calling the clinic. The nurse or the veterinarian comes out and takes your pet. Most of the time, we're trying our best to do a 6-foot distance from you. So there's some shenanigans with leashes. You bringing a leash if you have a dog, standing at the end of the leash. We put our own leash on, stand at the end of our leash so we can maintain that 6-foot distance. Then we bring the animal into the clinic. We do all the hands-on things that we need to do. We do that with minimal touching from what we can. And then we bring the animal out. So that is curbside service. That is the best that we can do for now. And we'll see how that evolves going forward. So in terms of the veterinary client-patient relationship, that differs from state to state. In Massachusetts, where I practice, the VCPR, the veterinary client-patient relationship, is based around also having physical knowledge of the animal. So that's my hands being on the animal to make sure that I know what's going on with their body. So there are benefits and there are drawbacks to all these things. The benefits of using virtual care are that clearly it reduces risk during a pandemic. If there's something that you can ask me or ask one of my nurses about over the phone or over a virtual chat, then and I can weigh in and say, I am worried about that. Let's do this. Or no, I'm not worried. Let's check that when we can get back to everything in order. There is also the benefit of having safe information from someone who knows your pet. So instead of Googling all the things that are possibly going wrong, you can ask one of us about your particular pet to weigh in, and we know what's been happening with that pet. We have our records, we have all the lab work and x-rays that may have been taken. Other benefits include convenience. It's much more convenient to be able to do a virtual chat for many things these days because it keeps us in the house. And I think going forward, we may use this in the future as well. It is also a lot easier to have better communication this way. If we're waiting strictly for exam times to discuss everything, a lot more water can go under the bridge. And by having these virtual ways of staying connected, we can keep on top of problems and all be like on the same page when it comes to these things. Benefits during normal times would be things like shorter follow-up time. So I'm known at my clinic for saying, I definitely want to see you back in 2 weeks. And then my receptionist or my veterinary nurses will say, you don't have any appointments in 2 weeks. And so virtual care might allow us in the future to be able to have better follow-up times because we can probably see more patients in a shorter amount of time. For my patients as well, where a lot of them have mobility issues, it might be nice also to be able to do things not having to leave the home, so we can save our mobility charge times for things like walks around the block. Clearly, all of this could have the potential to have greater access to veterinary and nurse input. Sometimes there certainly is the possibility of having lower cost overall and more widespread access. So in alternative medicine, there's not enough of us out there to weigh in on the different various modalities and supplements. So having telemedicine or virtual care be part of our practice might be able to get us to the people who are maybe quite a drive away and don't have access to an alternative medicine vet. It's also really fun, and I'll bring this up a little bit more in a bit, but to be able to have us help demonstrate what you can do at home. So for instance, we always talk about giving a pill to a cat and how the biggest part is just knowing that you can do it and you're going to get this done. But we can actually help illustrate these things by showing them on our animals, the different techniques. And also, it just makes things a lot more personalized. So we can, and at Sleepy Dog, we're trying to come up with some kind of interface for telemedicine and virtual care going forward. But hopefully it'll be something that it will feel good because it will be just about your pet and everything will be about that pet and that pet's needs. All right, so we talked about the benefits. There are some downsides. So it is definitely more difficult to become a patient with virtual care if you're a new patient or a new client, because we don't have that history of being in the same room together and we don't have that history of the physical exam. So again, as we go forward, we'll have to see how everything is affected and how long this COVID-19 will affect the way we are doing curbside medicine and the way we're doing telemedicine. So stay tuned for that. I think also just another kind of focus on the physical exam and how important it is. A physical exam to a vet is the first and one of the most important things that we can do before any other tests. So it's putting our hands on your pet's body and looking at them from nose to tail and making sure we know what's going on. It's feeling for lumps. It's listening to the heart. It's listening to the lungs. It's feeling the joints, seeing what their range of motion is like. It's looking at their face and how they respond when we're doing different parts of the exam. It's looking in their ears and their eyes and their mouths. So that is probably one of the hardest things for me to miss with doing virtual consults, but it'll make me be creative. The other thing is, and this could be thought of as a downside or an upside, is that there's going to be increased reliance on what our pet parents say or what our clients say about what's been happening. So because I cannot feel that animal and because I cannot see that animal, it is something where I'm going to have to rely more on what you tell me about that animal. It's up to me to ask the right questions, but it is really important for everyone to be recounting the best data that they have. And of course, for me, whose favorite modalities are acupuncture and chiropractic medicine, it is definitely harder to do that virtually, and I can't do it at all. So I'm going to rely on my curbside service to help my patients with pain in terms of doing acupuncture, chiropractic, cold laser medicine. But there are some modalities that I'll discuss in a second that have more to do with that. All right. So what are the options at Sleepy Dog? If you have a question, the options would be you could set up a virtual veterinary nurse visit with Sam or Emily. You could set up a virtual veterinarian visit with me, Dr. Beth, and in the future, Dr. Jenny Lou. You could also set up for some energy work. And Nurse Sam is a Reiki master and does amazing things with Reiki medicine, which is transmittable remotely. There are also something that we've rolled out, which is massage, acupressure, and Tui Na tutorials, which Nurse Sam is doing. She's trained in all of those and can help you learn how to do those different techniques on your animal at home. And so what she does is she sets up a Zoom call, and she will be on one end with her animal, Bowie, who many of you know, and then you will be on the other end with your animal, and she can kind of walk you through some different massage techniques, some places to apply pressure that have to do with acupuncture points. So instead of me placing a needle or doing an injection in an acupuncture point, it's using your hand to apply pressure. And that talks to the body and says, oh, something is happening at kidney 3. I better do these certain sets of things. Tui Na is a type of Chinese massage that also works on acupuncture points and can be incredibly not only soothing and comforting to animals, but therapeutic. There's also seeing me as a virtual veterinarian visit, and then also electronic prescription refills. At this point in time, because we're all in an emergency, we will be happy to fill general medicines, we will be happy to fill herbal supplements, and also prescription food if your animal needs that. Typically, we only do alternative veterinary care, but in light of trying to keep the life the simplest and having the least amount of person-to-person contact, we will do whatever we can that we need to help with. I am trained as a veterinarian, so I'm happy to do that. So what could you ask in a virtual nurse visit? You could ask about any questions you have about your pet's diet, any questions you have about what medicines they are on, or medicines that you feel like you might be getting a sense that you're interested in or has been mentioned before, what the side effects of those medicines are, when to give them, how to give them, all those types of things. Behavior changes, that's a very common question that our nurses receive, are different changes in behavior or maybe symptoms that are coming up that you're noticing. Very common. People don't know if it's something to worry about. And that's what we're here for, is to tell you whether to worry or not. And if we tell you to worry, then we're going to help you to manage those worries. So we can go from there. When it comes to a virtual veterinary visit, what we're going to focus on is those new symptoms and new behaviors, and if we're worried about them. Do we need to tweak different things when it comes to diet? At Sleepy Dog, we love wholesome diets. We love the more whole foods, the better. We love managing diets with therapeutic energetics in mind. So if you have a dog who's hot and panting and has red skin all the time, I want to feed that dog something nice and cool to cool their system down. We can also talk through, is there a need for us to do some further testing, and what testing might that look like? If we're seeing some symptoms that we are worried about, then what kind of tests would we do, and how would we do those tests in this current situation. We can absolutely do blood work. We can test urine samples. We can test stool samples. We can do all sorts of imaging, but we need to make sure that it is needed now and that it is important to the health and the well-being of that animal. And we're happy to do that. And then new treatments. In alternative veterinary medicine, one of my favorite things is there's always something to try because there's always something new or old that we're integrating into our practice. So there's always things that we can institute. And finally, if there are any questions, any topics that you are interested in learning about, we will be doing more of these Facebook Lives as long as it's something that seems to be helpful for people. So if you have topics that you would like me or any of the members of my team to discuss, I'm happy to do so. My favorite topics to talk about are acupuncture, chiropractic medicine, herbal medicine, nutrition. I love to talk about the human-animal bond. I love to talk about how we as people are integrating animals into our life and mental health. I love to talk about team building and things like that. We also have Emily and Sam, who have very huge skills, and Sam's going to be doing some Facebook Live on what it's like to do a massage tutorial and what kind of insight you can gain from that. She can also touch on distant Reiki or distance Reiki and how that might be helpful. These are all modalities that we use every day in our clinic, and so we're happy to share them and figure out what we can do to help you. Another thing that would be really helpful for me to hear from you would be to see if there are any requests or ideas for how virtual care might be helpful for you. There are different options in terms of different platforms, and we would love to help and come up with some programs that would be helpful to everyone. So with that, I think that that is all I have to say for today. If there is any questions, I will figure out how to answer them online, and I'll do it via Facebook. And if there are any other topics, just let me know. You can email us at dreamteam@sleepydogvet. You can visit us on Facebook, as you are now. We also have an Instagram page. Our website is sleepydog.vet. And let's see, what else? So anything else that you want to hear about, just let us know, and I will sign off for today. Again, it's Dr. Beth, Sleepy Dog Veterinary. Thank you.